The International Health Regulations are currently an 84-page document that really is improperly named. Part 2 of the International Health Regulations is really the core of what they are all about: information and public health response. Article 5 talks about surveillance. Article 6 talks about notification. Article 7 talks about information sharing during unexpected or unusual public health events. Article 8 talks about consultation, and Article 9 talks about other reports. But you have to go all the way down to Annex 1, which talks about the core capacity requirements for surveillance and response. Our primary obligation under the internationally legally binding international health regulations is that we shall utilize our existing national structures and resources to meet our core capacity requirements under these regulations, including and with regard to the surveillance, reporting, notification, verification, response, and collaboration. And at a local level, we must have the capacity to detect events involving disease or death above expected levels for the particular time. And this information shall include essential information regarding clinical descriptions, laboratory results, sources and types of risk, numbers of human cases and deaths, and conditions affecting the spread of the disease and the health measures employed. Over the last 2 years, nations around the world have experienced enormous spikes in excess death. Australia had a spike of 30%. Austria saw numerous spikes above 30%. The Bahamas saw a spike well above 100%. Belgium saw spikes above 30%. Brazil saw spikes in excess mortality above 80%. And Canada saw spikes nearly 20% above normal. I can go on and on and on and on around the world. When you see spikes, as what happened in Hong Kong, that were above 160% of normal, I can say with great certainty that something was going on in Hong Kong at this time that was very abnormal. I encourage people around the world to reach out to their local authorities and demand to see the information that they were legally obligated to report to the World Health Organization in regards to the abnormal spikes in excess mortality over the past few years. I would like to ask everyone who is watching this video to do whatever research you can to identify information regarding excess deaths over the past few years, and put your links in the comments below on this article.